If you are tired of always being sweaty, today is the day where you can take control and do something about it. Just think what your life would be like with no more pit stains or slippery hands. In this video, I am telling you exactly what to buy and what not to buy to fix your excessive sweating right now without a prescription. I'm Dr. Maren Locke. I'm a board-certified dermatologist, and I have treated patients with excessive sweating or hyperhidrosis for years. I am giving you all the inside secrets of what happens in the dermatologist's office when I see you for excessive sweating. Buckle up, you are about to be on the fast track to controlling your disease like never before. Even if you just have normal sweating and don't qualify for a true hyperhidrosis diagnosis, watch this video for some great tips and products for a nice sweat-free day. I get the sense that you are feeling like you need to take notes. I see this all the time in the comment section. But today, you get to put down that pencil because I took notes for you. You can get my How to Stop Sweating PDF at the link in the description below. This PDF is your roadmap to success with conquering your hyperhidrosis. It builds off this video with a summary of all that I'm talking about here and goes further into your next steps of treatment beyond topicals so that you will get even closer to the finish line. You may walk into your doctor's appointment knowing even more than them about your condition. That is how many pearls I'm about to give you in this video and in my PDF below. Truthfully, I want you to get better. I want you to have a better quality of life, and hyperhidrosis is one of those conditions that we can really improve so much. So don't suffer in silence anymore. Let's get you better. Please remember, this video and my PDF are for informational purposes only. Think of it as edutainment. It is not medical advice. Although I am a dermatologist, I am not your dermatologist. So please seek professional care before starting any treatment. Now is a great time to subscribe to my channel. I'm known here on YouTube as the Budget Dermatologist, where I make skincare and skin health approachable and affordable. I give you all the over-the-counter solutions for common skin problems so you can fix your skin without even setting foot in a dermatologist's office. When you cannot access a dermatologist or when you cannot get the quality time that you need and deserve when you are face-to-face with your dermatologist, you can come here and find the information and the answers that you want and that you need and that you deserve. So hit subscribe right now, give this video a thumbs up, and let's spread the message that healthy skin is within reach. You say sweaty pits, I say hyperhidrosis. That's the medical term for what we are talking about today. It is excessive sweating of certain body areas such as the armpits, the palms, feet, or the scalp and face. I know you are asking, why me? What did I do to deserve this annoying condition? The truth is, hyperhidrosis is a complex condition with a lot of triggers. It may be genetic, meaning that it's passed down from one generation to the next in your family. You might not even know that some of your family members suffer from this condition because there is so much stigma around excessive sweating, so people just don't talk about it much. But in reality, hyperhidrosis affects almost 5% of the US population, so you are far from alone. And that may be a gross underestimate because it is an embarrassing condition, so many people will probably not even report this. Other countries outside of the US have an even higher incidence of hyperhidrosis. And do you know what scientists think cause your hyperhidrosis? It is hypothesized that, and I quote, complicated malfunctioning of the autonomic nervous system involving both the sympathetic and parasympathetic systems causing neurogenic hyperexcitability of the reflex circuits leads to hyperstimulation of otherwise normal eccrine sweat glands. So what does that mean in simple non-doctor speak? It means that your anatomy is normal. You have normal sweat glands, a normal number and size, but your brain is sending too many signals to your sweat glands to produce sweat, more sweat than you need. So how do you know if you have hyperhidrosis? Tell me if this sounds like you. You may have hyperhidrosis if You have focal visible sweating. So in just one area of the body, you can see the sweating. This has been going on at least 6 or more months, and there is no secondary cause for your sweating, meaning that you're not on a medication or have some other condition that is causing generalized sweating. And you have to have at least 2 of these. So bilateral and symmetric sweating. It impairs your daily life. You have 1 or more episodes per week. It started before you turned 25 years old. You have a positive family history of sweating, and the sweating stops when you are asleep. So in order to have the diagnosis of hyperhidrosis, you have to have all of these and at least 2 from this list here. An in-office sweat test can also be done to confirm sweating and demonstrate the most active areas of sweating, but typically the history, meaning how you answer the medical questions and fit the criteria I just listed, is enough alone to make your diagnosis. Okay, so you think you have hyperhidrosis or you just have enough sweating that you want to do something about it. What do? How do you navigate all the products out there for anti-sweating? A quick Google search for antiperspirants will pull up hundreds of products. That is too overwhelming. Don't do that. Instead, listen to my easy solution for you. All the products that I mentioned are linked below. They work. They are all FDA regulated as over-the-counter drugs to treat this medical condition. To be approved, that means they have to scientifically demonstrate that they truly reduce sweating. And again, all of this is in my handout below, so don't feel like you need to copy down what I'm saying here. I am about to get into the nitty-gritty here of the key active ingredient that will solve your problem. But it can be tricky. It's actually not very straightforward, especially since marketing claims on antiperspirant products are meant to mislead and confuse you. But again, not if you're my friend, we know better. And that's all in the PDF handout below. So there are 3 main categories that I can offer you for the treatment of hyperhidrosis. These 3 categories are topical treatments, meaning things that you put on top of your skin, oral treatments or pills that you take by mouth to decrease sweating, and devices or procedures that are done in the office or under the direction of a specialist. Now we can group these 3 categories here by those that are available to you over the counter without a prescription, and those that will require a prescription from a licensed healthcare professional. So most topicals are over the counter, and the oral and devices and procedures are mostly all prescription based or require you to be in the office or under the supervision or direction of a healthcare provider. I say most topicals because there are a few that have a really high strength of the active ingredient that does require a prescription. But that same ingredient is available to you at a lower percentage with less side effects right over the counter, and yes, they are still quite effective. So I will focus on the over-the-counter treatments available to you right now. To learn more about these 2 categories here, you will have to check out my handout below. So now, here is the over-the-counter treatment guide that you've been waiting for. You will look for a product with a particular active ingredient listed on the label. These products are FDA-regulated over-the-counter drugs and will typically be classified as an antiperspirant, meaning it will stop or decrease sweating. Here is a quick note about a deodorant versus an antiperspirant because I do not want you to get confused. A deodorant will only decrease body odor. It will not do a single thing at all to decrease your sweating, while an antiperspirant will actually decrease your sweating. I think of antiperspirants in one of 2 categories in my mind. There are those that are strictly an antiperspirant, and then there are those that are a hybrid deodorant and antiperspirant product, like those you see on the shelf at the drugstore or the grocery store. I am going to tell you why this distinction matters and why I think that you should opt for a true antiperspirant rather than one of those antiperspirant deodorant combinations for more severe forms of hyperhidrosis. The active ingredient we are looking for in your antiperspirant is aluminum. But this is where things can get really confusing for you, the consumer, because there are a lot of different types of aluminum compounds that you will see listed on the ingredients labels and many different percentages in these products. So how do you know which type of aluminum is best and what percentage should you be looking for? I am going to simplify it here for you right now. So there are actually 18 types of aluminums approved by the FDA for use in antiperspirants. The aluminum listed in the active ingredient of antiperspirants will most likely be some variation of one of these three. So aluminum chloride, aluminum zirconium, or aluminum sesquichlorohydrate. So the maximum percentage of the aluminum allowed in the product over the counter without a prescription depends on the exact type of aluminum it is. So for example, aluminum chloride can be up to 15% over the counter. Beyond that, you need a prescription. Aluminum zirconium can be up to 20%, and this last one can be up to 25%. Now, you do not compare these apples to apples. So 20% aluminum zirconium isn't stronger than 15% aluminum chloride. Okay, that is where consumers, you guys, can get really confused. And of course, these companies will use marketing strategies to confuse you and make their products stand out by saying highest percentage of this and that. Well, it depends on what type of aluminum it truly is for how effective it might be. Here's the deal. The aluminum chloride form has the most research behind it and is the most effective of all aluminum topical preparations. This is available over the counter up to 15%. Aluminum chloride works differently than the other aluminum compounds. It penetrates to a deeper level of the sweat gland to stop sweat where it starts. Aluminum chloride molecules are very small. They fill the sweat gland better than the larger aluminum compounds that I have written here. However, with this form of aluminum being so effective, comes greater side effects compared to the other FDA-approved forms. So let's talk about side effects of antiperspirants. This is important because this can really limit your success with this treatment if you aren't careful or know what you are doing. So let's talk about what the side effects are and how to prevent them from happening. Common side effects of antiperspirants are burning and irritant contact dermatitis, which is basically a red rash that can be flaky, itchy, painful, and just overall really annoying. In general, the stronger the percent and the smaller the size of the molecule, the more likely you will get some degree of these side effects, especially if you are using it incorrectly. However, some types of aluminum will be more gentle and better for sensitive skin types or allergy-prone skin types. These can still be effective at cutting down sweating, but far less likely to cause burning and irritation. These aluminum molecules are a bit larger, so they don't penetrate as deeply, which means less irritation. Let's take aluminum zirconium, for example. This is a partially neutralized salt, so it has much less burning associated with it, but it still works similarly by plugging the sweat duct. However, this plugs the duct more superficially, so it will give you perhaps less significant improvement overall, but it can provide all-day long control. This is a great option for sensitive skin, allergy-prone skin, or for someone with just mild hyperhidrosis who has never tried topicals before. Aluminum sesquichlorohydrate forms relatively large complexes. This particular aluminum ingredient is more gentle on sensitive skin, and it can last for days. So as a dermatologist treating patients with hyperhidrosis, when I discuss over-the-counter products with patients, I mention these types of aluminums, discuss the patient's skin type and things that they have tried before, and then we decide what is the best option for them to start with. And that is what I am doing for you here in this video. So if you have tried topical antiperspirants before, but you couldn't tolerate it, consider trying again with a more gentle form of aluminum. Or if you have tried an antiperspirant and it didn't work for you, let's revisit the ingredients label, look at what type of aluminum it was, look at what strength it was, look at how you were using it, were you using it correctly and consistently enough, and we can optimize your results by making sure you are nailing down the best product and using it correctly. So here are my top recommendations for topical antiperspirants. In the aluminum chloride category, this will be the strongest, possibly have the most side effects, and will work the best for more severe hyperhidrosis. One of the most recommended products by dermatologists is by the brand Certain Dry. You can find this in the drugstore or on Amazon, and it is very affordable. This brand has 3 main formulations. Their single most effective product is Certain Dry Prescription Strength Clinical. It has 12% aluminum chloride. Again, the maximum over the counter is 15%, so this is pretty high. And it has a very simple ingredients list. This is just a pure antiperspirant, and it is only about $6 on Amazon. Another great choice in this category is by the brand DuraDry. This brand has a product called DuraDry PM, which has 15% aluminum chloride, so even stronger than the Certain Dry, and this is in fact the highest that you can get without a prescription. But what also makes this product unique is that it has salicylic acid in it too, which improves the efficacy and tolerability of this product. It has really great reviews. I have personally tried this and I have had patients use this with great success as well. So those are my top 2 choices for this category. Different price points. The DuraDry you will pay a little bit more for, but it has the higher strength aluminum chloride and added ingredients to make it more tolerable for you. So you can decide for yourself if that is worth the extra price. I have a discount code for you, which I linked below, and that will help decrease the price of the product. In the aluminum zirconium category, I'd like to recommend this category for mild hyperhidrosis, or if you have sensitive or allergy-prone skin, or if you have tried an aluminum chloride product but you couldn't tolerate it. Try a product from this category. You will see this more commonly in the combination antiperspirant and deodorant products that I mentioned earlier, like your classic products by Dove and Secret and Suave. However, many of these products labeled as antiperspirant deodorant combinations do not have the maximum strength aluminum allowed, so you really need to check the label. Lower strength aluminum zirconium will only be helpful somewhat for more mild forms of hyperhidrosis. But my recommendation is if you are going to choose a product from this category, get one that is 20%. This particular aluminum compound is more gentle, so it is probably okay to get a higher strength here and you likely won't get irritation. Certain Dry makes a product called Everyday Strength Clinical, which has the maximum amount allowed of 20% aluminum zirconium in it. And DuraDry makes a product called DuraDry AM, which has the maximum 20% aluminum zirconium in it as well. It also contains a combination of sweat-absorbing and odor-trapping ingredients as well as skin protectants to help decrease irritation. Now, this third category I briefly mentioned here uses aluminum sesquichlorohydrate as the active ingredient. Again, this is the one that forms really large complexes, so it doesn't penetrate that deep. Great for sensitive skin or for those who do not want to or cannot apply a product every night. This compound will provide protection against sweating for up to several days. So depending on your lifestyle, this may be a better option for you as you won't need to apply it nightly. Certain Dry has a product called Extra Strength Clinical that I recommend for this category. Another awesome hyperhidrosis product to have on hand is antiperspirant wipes. The brand Sweat Block makes a clinical strength antiperspirant wipe that has 14% aluminum chloride in it. This particular wipe is tested to provide you control of your sweating for up to 7 days. These are easy to use and they're really convenient for on the go or for applying the medicine in certain areas. A wipe just makes it so much easier. But my short list here is not to say there are not other products on the market that would work as well. In my handout below, I wrote down for you the guidelines for what to look for in the active ingredients, what percentage to look for, so you can refer back to that when evaluating new products that you may want to try. You know I'm the skincare routine queen if you have seen any of my other videos on my channel, so let me tell you about the importance of thinking of your hyperhidrosis treatment and products as a complete skincare routine. I recommend treating hyperhidrosis with 2 products. One you will use in the morning and one you will use at nighttime. The nighttime product is the most important and it is the key to your success. You must apply this product at night because this is when your sweating is the absolute lowest. This is when you want your antiperspirant to be applied so it can most effectively plug the sweat duct. And if you are looking for the most drastic results or have more moderate to severe hyperhidrosis, choose an aluminum chloride compound like DuraDry PM, which is the maximum strength available over the counter. For the morning time, use a combination antiperspirant deodorant product with aluminum zirconium in it, at 20% concentration. To decrease your risk of side effects with this medication, make sure you apply this to very, very dry skin. Use a hairdryer to the skin if you have to. Do not apply this directly after you shower, as your skin is still damp. Avoid scrubs or harsh washes in the shower, because that will set you up for micro tears in the skin and can increase your chance of irritation. Whichever product you choose, make sure you follow the instructions on the label for proper use. For example, if it says to wash it off in the morning, make sure you do that. Most of these products you will need to use nightly until you have decreased sweating, and then can likely decrease your use to just a few times a week to maintain these results. If you are someone with very sensitive skin, allergy-prone skin, or you have mild hyperhidrosis, you of course have the option of starting with products that have lower strength concentrations of aluminum in it and going up from there slowly as tolerated. You might not want to start immediately with an aluminum chloride 15% product. Instead, just get the antiperspirant deodorant combination off the shelf with aluminum zirconium in it and start applying it nightly to your underarms and see how much of a difference this makes. If you follow this hyperhidrosis skincare routine, many of you will drastically improve your condition and have a much better quality of life. Others will not get enough control with these products and need something more. As a doctor, I think about this in terms of what is called a therapeutic ladder. That means we start with the simple, low-risk treatment options first, and then we climb the ladder to each different treatment option beyond that if we still need more control over the condition. If you aren't getting better with over-the-counter topicals or are having side effects like burning that you just can't tolerate, you need to climb the ladder to bigger and better treatments. And I assure you, almost everyone will be able to get control of your hyperhidrosis. In my handout below, I have included my therapeutic ladder of what your next options are for controlling your excessive sweating. I'm talking about pills you can take, Botox injections around the sweat glands, home devices you can buy that are drug-free options that get great results, energy devices, and surgical procedures. This PDF handout is all packaged up nicely for you so that you are equipped with the most knowledge before your doctor's appointment. This will help you know what questions to ask and understand your options and get the most out of your doctor's visit and truly be the best advocate you can for yourself. It's like I said before, you will be putting yourself on the fast track to controlling your disease. It is well worth the time that you would otherwise spend on Google trying to piece this together yourself amongst a sea of misinformation and marketing ploys. And I even have a whole section in my PDF devoted to the controversy of aluminum in topical skincare products. If you have a question about that, check out my PDF. I have thoroughly considered this concern, given my professional interpretation of the data on this, so that you can decide for yourself if this is something that you should use or avoid in lieu of other treatment options. I hope this in-depth summary of hyperhidrosis gave you a lot of clarity on your condition, and I hope you learned a few things that will truly improve your quality of life. Don't forget to subscribe, and I'll see you guys soon.